Okay, so we're just getting our first look inside the shoulder. The camera's coming in from the back. In the front, we have this blue dry dock. And we're about to place our camera in the front. It's going to go over that switching stick. But this is your biceps tendon. If we look up, we can see your rotator cuff looks just fine. If we look down at the biceps anchor, by rotating this way, we can see that this actually is not fine. So we're going to be reattaching that as well with a 1.8 millimeter Y knot. It's a double load type of anchor. We'll show you that in a minute. We're going to be placing the entire Y knot family of anchors in your shoulder today. So we'll show you what that means. As we look down the front of the shoulder, we can see what we expected, which was a Bankart lesion. All this damage down the front. Okay. A little bit of cartilage damage as well. And as we look towards the back, we can see a large Hill-Sachs lesion right here. And so ideally, the humeral head would be sitting here. But you can see how it sits a little bit inferiorly and anteriorly subluxated. So we're going to get to work on all this. The first step is to do this, what we call our Remplissage procedure. We'll get to work on doing that and show you in just a minute. Basically, we're going to place an anchor. You can see where the white cartilage stops. You're going to place an anchor more in the red area and reattach some of the capsule and even some of the tendon into that area here, right where the tip of that cannula is. Okay, so here we can see the Hill-Sachs lesion. We're going to turn the brightness up on the TV a little bit more. And we're going to turn the outflow up to medium. Okay. We're ready to go ahead and plan placing one or maybe even two suture anchors in. Okay, so here we're just planning our suturing. We're going to use all three sutures on this one. Sometimes we only use two. But on this one, our choices are to use all three sutures or to place two anchors and use some combination of the sutures. But with the size of the defect, I think we're going to place one anchor and use all three sutures. So you can see the angle here. We're going to go ahead and make a little nick in the skin, and then we'll show you some more in a little bit. Okay, so here's the first mattress stitch with that black and white striped suture. We're going to do the same thing 2 more times and just stack these mattress sutures up from inferior to superior. So the next set is going to go there, and then the final set will come way up here. We'll show you some more when that's all done. Okay, so we've got all three mattress sutures tied. I just want to show you what it looks like here. 1, 2, they're purposely overlapped just like that, and 3. Okay, and so now I'm going to pull on them just to show you the effect. See how it pulls the humeral head back? And now we're going to get to work in the front of the shoulder. So we're just getting started in the front. Pause. Okay, so here's our first anchor down in the front. You can see our position here. We're going to reach in there and try and get a good bite of that labor, and we'll show you some more in just a minute. Okay, I wanted to show you our suture hook. It's got a 45-degree turn to the right. It's loaded with that same black wire you've seen before. It's called a super shuttle. And so we rehearse the stitch by placing the tip right there. We're going to rotate and go into this inferior ligament and capsule back about here. And then we're going to bring it down and completely underneath. Okay, and that looks like a pretty good bite right there. We'll go ahead and feed that through. Okay, so we've passed and tied 2 of those anchors. This is the third one that we're getting ready to pass and tie. But you can see how in the front things are starting to look a lot better. Happy with that. So we're going to keep working. I just wanted to give you kind of an interval update here. Okay, so now we've got all 3 sutures tied in the front. That looks good. We're going to put the camera in the back of the shoulder again because we've got to work on that biceps anchor. We still haven't tied the Remplissage sutures. You can see them at the top. But you can also see how much harder it is to see them now because the humeral head is already reduced from the anterior reconstruction. Switching sticks. Okay, we're all done here. We've tied the Remplissage sutures. Those are holding that humeral head back. The humeral head centered over the socket. I'm happy with that. We've tied the slap lesion anchors as well. So we're going to finish up here. We'll take our shaver one last time here. Don't want to get too close to our anterior anchor there. So we're going to finish up and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.